The question about how this is going to change medicine going forward, I think probably should be divided into two. How's it going to change the business of medicine? There's a huge tailwind that's filling up the sales of the bigger organizations. They've been quite avaricious here in my own world. There are two 800-pound gorillas, the Cleveland Clinic Foundation and Case Western Reserve University Hospitals. And they've been on a 10-year tear, buying practices, opening offices, building hospitals, for God's sakes. They have been really, really well-run businesses, and well-run businesses take advantage of weakness in their competitors. And and there's nothing personal about it. They didn't target Darrell White or Sky Vision and say, all right, we need this guy's business. It's just the way things happen. So from a business standpoint, as I mentioned, I think the tailwinds are in the sales of the big organizations, and the headwinds for small practices are ever greater. We think of how we practice and think of how things are going to happen going forward. I think there are a couple of things that seem to be developing. The whole telemedicine thing is, it's the genie's out of the bottle. So whether we're talking about ophthalmology or primary care or other types of medical specialty cares, the telemedicine genie is out of the bottle. And it's going to be really a whole new world. You can have a doctor sitting in front of a screen and doing visits one-on-one with patients. The overhead to do that is minimal. And we, just as an aside, we're going to see huge profiteering from that. You can expect that Epic, the big EMR company, will swoop in and take a dominant position in that and just suck more money out of the system. We'll see money diverted from doctors and nurses and nurse practitioners and optometrists and physical therapists, and people are going to do that online, to big corporations. I think that in ophthalmology and eye care in general, we're just now starting to scratch the surface, and I think that we'll see more of that. At the end of the day, eye care exists, and eye care is provided in the sacred 6 inches between the eye doctor's eyes and the patient's eyes. We sit at the slit lamp. We put a contact lens on their eye to look at the retina. We treat them in that 6 inches, and that's just not going to go away. The telemedicine that we have, taking pictures of the retina, looking for diabetic retinopathy, sure, yeah, let's go for it. From a more macro standpoint, I don't think this is going to have any impact or any influence whatsoever on the different responsibilities for ophthalmologists and optometrists. This really is not going to change the demographics or the demographic macro issues that we face. I'm at the end of the baby boom, tail end of the baby boom, and we're living longer. We're doing 3 million cataract surgeries a year. That's going to go up, and that's not going to go away. We're still going to see a shortage of capable surgeons to take care of that. The more surgeries that are necessary, the more work from a medical standpoint that's going to be shunted probably to optometry. I don't think that that's going to change those macro forces at all. And I think it's interesting. I don't know what it says, but I think it's interesting the way the different national organizations handle this. The American Academy of Ophthalmology late last week didn't suggest, didn't recommend, it demanded that all ophthalmology practices essentially close and shut down to only emergency issues. The American Optometric Association only came out with a similar thing on Tuesday or Monday. Interesting. I don't know what that says. But going forward, that dynamic is unlikely to change.